Hello, my name is Ryan Terlau. I'm one of the plastic surgeons at Muskegon Surgical Associates. We're here today to talk about hand and finger fractures. So hand and finger fractures are a very common thing that we see. This can be a work-related injury, a hobby-related injury, or just simply a fall on the ice. When it comes to displaced fractures or fractures that have moved significantly from the trauma, those typically require more operative intervention. So there's several ways to treat the fracture, but the main portion of treating a fracture is getting it reduced. The fracture has to be placed back into its anatomic positioning. And once that is done, it needs to be held in place by several different means. In fractures that are stable, once you reduce them, sometimes a cast is good enough to hold them in place to allow for healing. Most fractures in the hand, because of the tendons and the muscles pulling the wrist or the fingers in different directions, are unstable. Those require fixation. The two ways to do that are with percutaneous pins or wires that we place in the operating room down through the bone to immobilize it for a temporary amount of time. Those K-wires typically come out after about 6 weeks, and we follow the progression in the office with x-rays to make sure that you're healing adequately. The other option for bigger fractures or more unstable fractures is to place plates and screws inside the hand or the wrist. Typically, plates and screws stay in permanently. If they become painful or cause problems down the road, we can always remove them. We also follow these plates and screws with serial x-rays over the next 4 to 6 weeks after placement to ensure that the bone is healing properly. One of the big advantages to placing plates and screws in the hand or the fingers or the wrist is that you can begin range of motion much more quickly afterwards. If you're in a cast, the cast typically stays on about 6 weeks. With plates and screws, we can get you moving within a week. If you have plates and screws placed for a hand fracture, we typically have you see the hand therapist within a week after surgery, and then 2 to 3 times a week for 4 to 6 weeks afterwards. If you are worried about a hand fracture or a displaced fracture, we're happy to see you in the office and discuss your case, and we can go over your x-rays with you right here in the office. So if you're concerned about having a hand or finger or wrist fracture, this is something that you should see us in the office for. We can get an x-ray here in the office the same day, evaluate your fracture, and we typically follow you closely over the next 2 to 4 and then 6 weeks to see how your fracture is healing. If you're concerned about having a fracture, we're happy to see you in the office, as every case is slightly different.